One of the important lifelong lessons that I learned from Katrina was that people who don't have means often die. 40% of people in New Orleans did not have access to simple automobiles or travel to get out of the way of this deadly storm. The storm of cardiovascular medicine still looms large in the United States. We need to help our patients have tools to get out of the storm that causes unnecessary death and disability. Beyond my nuclear family, my entire community did everything they could to make sure that I was successful. One of my goals when I became a physician was to give back. And for over 3 decades, I practiced in that same Ninth Ward, serving mainly an African American population to identify, prevent, and treat cardiovascular disease. In an attempt to overcome some of the disparities in heart disease and stroke we all too commonly see. Blacks experience 21% more deaths from heart disease than whites. This disparity gap is expected to increase without thoughtful collaboration among stakeholders and more equal access to care and treatment. It's important to understand that we are here for the patients. We are treating patients from their perspective. It's important that we in healthcare deliver care to all persons equally, regardless of race, ethnicity, sex, gender, social class, or geography. My personal goal, therefore, is to do the little bit I can to ensure that we are making efforts towards reducing and eliminating these racial and ethnic disparities. The National Minority Cardiovascular Alliance is a central space for diverse thought leaders to work collaboratively towards reducing cardiovascular disease disparities in 4 minority communities: Blacks or African Americans, Hispanics or Latinos, Asian Pacific Islanders, and Native Americans or American Indians. The Alliance unites thought leaders from broad sectors to bring a comprehensive perspective and understanding to the complexities of minority health. The Alliance is working to help close the gap in cardiovascular health outcomes through various means. 1, enhance data availability and information sharing. 2, improve access to care, especially for novel therapies. And finally, increase minority participation in clinical trials. I joined the National Minority Cardiovascular Alliance out of a lifelong commitment to promote cardiovascular health equity. Never before has it been so critical for thought leaders to come together to ensure proper care among diverse populations. Collaboration is a key force in addressing some of the nation's most pressing challenges. Together, we can save lives and reduce suffering in a multicultural society. The National Minority Cardiovascular Alliance is working to close the gap in cardiovascular health outcomes by considering the interconnected cultural and ethnicity factors when gathering and utilizing data, designing strategies and interventions and other activities to better serve these populations and reduce the unnecessary cardiovascular disease disparities. The goal of the Alliance is to strengthen its members through shared purpose, deeper understanding, amplified voice, and expanded resources. We seek to partner with stakeholders like you across many sectors to advance critical work in this area. We welcome all minority cardiovascular stakeholders to join us. For more information on the National Minority Cardiovascular Alliance, please visit our website.